minimally invasive cardiac surgery. Okay, now before telling you what is mix, it's an advanced procedure. I'll tell you what is a conventional or a open heart surgery. In a conventional or a open heart surgery, we cut open the chest bone, I mean the breastbone, which is commonly talked about. It is in the center of the chest. We cut open the bone and then we expose the heart and we do the surgery. So, whereas now what I call as minimally invasive cardiac surgery is we do not cut down any bone in the chest, be it the sternum or the rib bones. We do surgery through small incisions on the chest, means small cuts on the chest, which are either on the left side of the chest or the right side of the chest, especially between the intercostal spaces. That is practically no cutting of any bone. So this is not, it's an advanced form of cardiac surgery which has gained rapid momentum and rapid widespread acceptance in the recent years, maybe in India, especially in the last 4 to 5 years. As far as of my knowledge, not many people even know about there's a procedure like mix in cardiac surgery. So essentially, to differentiate between open and heart surgery and a minimally invasive procedure, it is something like a laparoscopic surgery which is done through small incisions. So now coming down to the benefits of minimally invasive procedures. So we have multiple benefits in minimally invasive procedures. The first most important thing is it is cosmetically superior. The scars are very smaller, and usually after 6 to 1 year of time, rarely we have noticeable scars on the chest. So the second benefit, so because it's a minimally invasive procedure with minimal damage to the body or tissue trauma, the recovery is very fast. So on an average, a patient admitted for a minimally invasive procedure, we discharge on the 4th day after the operation, and usually after 15 days, the patient can come back to his normal activities such as driving, lifting weights, and doing all other routine activities which is usually not possible in conventional heart surgery. Whereas in conventional heart surgery, because we cut the bones, it takes time to heal. Usually we advise not to drive for around 3 to 6 months of time, and similar goes on to doing heavy weights like lifting any heavy weights, then works involving labor activities and all. So this is one of the second advantage we see in patients undergoing mix. The third important advantage that we see in minimally invasive is that commonly infection, when infection occurs as one of the complication either during or after the surgery, the recovery becomes much delayed and the risk for life also increases. So sternal osteomyelitis, which is called as infection of the chest bone, is a very dangerous complication because we do not touch any of the chest cavity bones. So the chances of infection is very less and the recovery is faster. Similarly, the incidence of blood loss and the require for multiple blood transfusions is lesser in case of patients with minimally invasive procedures. The fourth advantage, preservation of lung function. So normally when we do an open heart surgery or any other cardiac surgical procedures, the patients are put on ventilator after the operation for a duration on an average of 12 to 24 hours. So patients who are obese or patients who have lung dysfunction, it is difficult to bring them out of the ventilator. Whereas in patients with minimally invasive procedures, the lung function is not compromised. So in such cases, it is easy for the patients to recover and bring them or wean them off the ventilator. One of the advantage in patients undergoing minimally invasive CABG, as you all know that bypass surgery is the most common cardiac surgical procedure that is performed worldwide as well as in India. Now, as you know that India is becoming the diabetic capital of the world, more and more patients are presenting with coronary artery disease, means a disease which causes blockages in the heart arteries, I mean commonly called as heart attacks, patient presenting with heart attacks. In such cases, in conventional surgeries, we take grafts either from the chest or from the hands or from the legs, whereas in minimally invasive procedures we do not cut open whole of the upper limb or the lower limb for harvesting the vein. We have an advanced technology which is called as endoscopic vein harvesting technique. In this, instead of cutting open the entire length of the leg, we make a small incision of around ½ inch and then we harvest the vein. So practically in minimally invasive coronary artery bypass surgery, there are almost no cuts in the legs or in the hands. It is only a 2.5 to 3-inch incision that is made in the chest. The most common question that I face as a cardiac surgeon who does minimally invasive surgeries routinely is, what are the options, I mean what are the surgical procedures that can be performed by minimally invasive surgery, the first point, and who are the patients in which minimally invasive surgery can be done, and who are the patients in whom minimally invasive surgery is not an option. So coming to the first point, so minimally invasive cardiac surgery can be done in almost all adult cardiac surgical procedures. The common cardiac surgical procedures that are performed in adults are bypass surgery, which results from a disease in the blocked arteries. Second, we have valve replacement surgeries. The most commonly valves affected are the mitral valve and the aortic valve. So patients in whom valve replacements or valve repairs are needed can also be performed by minimally invasive technique. Now we come to the third group of surgeries, which are called as congenital heart defects. Congenital heart defects are basically heart problems which are present since birth, but depending upon the severity, they may either present either in the childhood or young adult age or in the old age. So these conditions commonly, which we call as a hole in the heart, may be an atrial septal defect or a ventricle septal defect. These surgeries can also be performed by minimally invasive surgery. Now coming down to the last group of surgeries, which are quite rare in the heart, these are called as the tumors in the heart. The most common heart tumor is called as an atrial myxoma. So this is also a surgery that can be performed by minimally invasive cardiac surgery. So now coming to who are the patients who are fit to undergo surgery. So usually most of the surgeries which are done by an open technique can also be done by minimally invasive technique. If you come to the percentage, around 80 to 90% of the cardiac surgeries which are feasible through an open technique can also be done through minimally invasive technique. However, there are certain contraindications. It means that certain conditions which make minimally invasive cardiac surgical procedure more difficult, and you need a more advanced expertise and experience to accomplish such procedures. These are like patients who are extremely obese, like patients who are overweight, patients are obese. In scientific terms, we call it as a BMI, basic metabolic index, of more than 30. These patients are a relative contraindication. It is called as relative because it is not that it cannot be accomplished, but it becomes technically more difficult and it is more riskier. But as you gain experience in doing minimally invasive surgeries, these surgeries can also be accomplished. In patients who are obese or what you call as overweight, cardiac minimally invasive surgery has many advantages. Like these patients, when the chest bone is closed because of the weight, the healing becomes more difficult. There might be sternal dehiscence, what you call as separation of the sternum after the operation, and especially difficulty in bringing out these patients off the ventilator. In these group of patients, especially though it is technically difficult to accomplish this surgical procedure, mix offers multiple advantages because there is no chances of sternal complications because it is not touched, and secondly, weaning off the ventilator means removing the patient off the ventilator after the surgery, as I told you previously, becomes much easier. And even wound healing problems are much more commonly seen in patients with obesity. These complications also come down, be it a muscle healing or soft tissue healing or even healing of the skin. So the second situation where minimally invasive surgery is relatively contraindicated is patients who have undergone previous lung surgeries or previous surgeries in the heart.